You may have decreased appetite, you'll stay up for hours, and you're on the go, 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 go. Psychosis itself, for the most part, consists of delusions. Hey everybody, welcome back to the channel. My name is Dr. B. This is Dr. B Addiction Recovery. The topic I want to discuss today is Taylor Schabusiness. Can methamphetamine-induced psychosis lead to ultraviolence and decapitation? I think this is a good topic to review, and it's been in social media and the news lately because it gives us an opportunity to take a look at psychosis, methamphetamine psychosis, and methamphetamine side effects, topics that a lot of people ask about. And as usual, the point of this channel is to distill complex information, create some scaffolding and clarity in your mind in the way you see things. So let's get started. A little background on this case so you have some foundation and groundwork if you haven't looked it up. This is a 24-year-old female, and I believe 2022, early in 2022, this 24-year-old female who is married and her husband was in prison at the time, was having a sexual affair with another young man, which I believe she met on social media. By the way, a lot of this stuff is alleged facts. And number two, I'm not diagnosing. I'm taking the information I have about this individual and trying to give you some idea of what may be happening. But for me, more importantly, it's an opportunity to educate about the topics at hand. Let's continue. So she was a 24-year-old female. Her husband was in jail at the time. She did have a child, and at birth, this child was taken away from her and in the custody of one of the grandparents. We're not sure if the child is actually her husband's or a product of another affair she was having. And she was at this time having an affair with another 24-year-old male that she may have met on social media. And the two of them were into S&M. And one of the things they enjoyed doing was choking each other. During this particular evening, they got together. He was using some chains for choking. Before they got started, they had smoked some marijuana. They had also done some methamphetamine. I'm not sure if they shot it up or they smoked it. In addition, they had injected some trazodone. Later in this video, I will give you some reasons why they may have used trazodone if you may not already know. So they proceeded to have their usual sex games, and during the course of this young lady started to choke this young man with one of the chains that he had brought in the usual course, I guess, that they would usually go about this kind of thing. He started to cough up blood, and he started to fight back. Apparently, and this is according to what she said to the investigators, she enjoyed it, she continued, he eventually expired. At that point, now keep in mind they had done methamphetamines earlier, as well as trazodone, as well as allegedly had smoked some pot preceding the methamphetamine and trazodone. After he expired, she went on to play with his dead body for 3 to 4 hours, including committing sexual acts on him. Eventually, when she was finished, she chopped him up into pieces, decapitated him, and put his head in a bucket and left and went home. She was subsequently arrested, and there was a very bizarre engagement where she was completely detached with the police officers that took her into custody, as well as the subsequent interview down at the police station. Other than this, interestingly, there's a paucity of information about her and her background that can feed into my understanding of her clinical disposition. Nevertheless, we do know a few things. As I said, she had a husband that was in prison at the time. She had a child, which may or may not have been his, but was in the custody of the grandparents. She has a history of, I believe, physical, if not physical, sexual assault by her father. In 7th grade, she has a history of diagnosis of bipolar disorder, polysubstance abuse, PTSD, and it's probably more likely chronic PTSD, as well as a suicide attempt in 7th grade. That's what we allegedly have as far as facts go for her. The way she recently came back into the limelight or social media reports is at one of her subsequent hearings. By the way, the charges on her are third-degree sexual assault, first-degree murder, and mutilation of a corpse. Pretty grim. So in any case, she's was recently at a hearing or in court with her court-appointed attorney who's been with her since the beginning. And I believe it was one of the competency hearings that she was going to, and it may not have been. And she suddenly jumped up and assaulted her attorney, and he subsequently discharged her as a client. There's never really been any emotional range in her presentation of the few videos that are online about her. Moving on, let's really analyze this to be able to answer the question. People are looking at this and, saying, wow, she's crazy. She's a psychopath. It was methamphetamines. What was it that caused her to do this? And you can really break this down in a very simple way and clarify it in your mind. Let's take a look at each one of these things. Methamphetamines. Before we talk about methamphetamine psychosis, let's briefly talk about the acute and long-term effects of methamphetamines. Methamphetamines are a stimulant, huge dopamine release. And essentially what they do is give you a sensation of euphoric sense of well-being. You may feel like you don't need any sleep. You may have decreased appetite. You'll stay up for hours and you're on the go, 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 go. Chronic use of methamphetamines eventually leads to psychomotor changes, including retardation. It could lead to chronic insomnia, depression. In addition, within all of this, and you can also have psychosis, and I'll get to that in a second. One other feature of it, whether it's acute use or chronic use, is poor impulse control and horrendous decision making. When you look up in the DSM, they have these categorized in different places. For example, long-term use leads to poor impulse control, bad decision making, and just a decline in cognitive well-being. I would argue that even the acute use, you'll see poor impulse control, poor judgment, and decrease in good cognitive processing. Within that myriad of symptoms that present themselves, over 40% of methamphetamine users, chronic users, will experience psychosis at one point in their lifetime. Now let's look at psychosis, okay? And, there's always these questions about, is it short-term? Is it long-term? Will it go away when you stop using methamphetamines? I've answered those elsewhere and I'll come back to it, but we got the issue with methamphetamines. Let's look at psychosis. What is psychosis? A good way to look at this is not a psychosis spectrum of disorders, but an umbrella with different diagnoses that can present with psychosis. The poster child diagnosis of psychotic disorders is schizophrenia, okay? And we'll get to that because then under schizophrenia, you have schizophrenic spectrum of disorders with severity as well as chronicity. For example, schizotypal, which is a personality disorder, is under the schizophrenic spectrum of disorders. Okay, let's go back with psychosis. We said you can think of it as umbrella. The poster child of it is schizophrenia. You can have drug-induced psychosis, another thing that falls under that umbrella. Psychosis itself, for the most part, consists of delusions. Okay, these are false, fixed beliefs about the external world that are not the case. And those have subcategories or modifiers, right? You could have paranoid delusions, right? You can have persecutory delusions. Let's leave those aside. So delusions, false, fixed beliefs. Then there's hallucinations. And hallucinations can be thought of your perception using the five senses and where they may be off, right? A person might have a perception of things crawling up their arm. They might hear things that are not there. They might see things that are not there. The different types of delusions and hallucinations that fall under psychosis really depend on the disease that's causing the psychosis, we won't go there. In addition, psychosis includes disorganized thinking and some sort of movement motor retardation or changes. In addition, that there can be negative symptoms of psychosis. I'm going to leave that aside because that is very prominent in schizophrenic disorders, and we're going to be talking about methamphetamine disorders. So that's the overall breakdown here. And the question is, could methamphetamine psychosis have induced violent behavior that included decapitation? And the answer is absolutely yes, because there is quite a bit of documented literature in violence induced by psychosis, and oftentimes it is with substance abuse or substance use. One of the reasons I don't talk about this much, because it is a small part of those that use substances, in particular stimulants, that get into a state of psychosis and have violent behavior. It's also stigmatizing. So one should be very cautious in discussing this. But in this case, I want to bring it to light. And can the methamphetamines have caused the ultraviolence and the decapitation committed by Taylor Schabusiness? It absolutely could have been, but I'm going to add something in this particular case. These things don't happen in a social vacuum. Each individual is a product, a long product of the environmental influences, negative and positive, that may have occurred to them. Taylor Schabusiness is really a tragic case, and I am not excusing her behavior, but it appears to be the case that she comes from a long history of first abuse, which may have induced quite a bit of mental health issues, including personality changes, and this person had a very difficult time coping as they came up. What is significant is also the fact that in the couple of years preceding this event, she was having repetitive run-ins with law enforcement, and she was digging herself a deeper hole by her lack of responsiveness to what was expected of her, her impulsive, reckless behavior that continued to close the doors for her progression in a healthy life, including gaining employment, taking care of her child, and making her own personal life better. This could have been a cause of and a mix of things occurring, including her bipolar, including potential trauma as a child and PTSD. But she may have also been continuing with her substance abuse during this whole time, which I don't have any information. And it's more likely that she was involved in chronic methamphetamine use and abuse that may have led to the events of that night. What is significant in her case is that from the videos that I've seen, the few videos that I've seen, I've never seen any well-adjusted emotional disposition on her part, including any remorse or any kind of feeling whatsoever. And it's very possible that this person is operating on the foundations of serious personality disorder, okay? And it may not be that she has antisocial behavior or psychopathy. It could be narcissism. It could be schizotypal behavior. It could be borderline. It could be a mix of all of these things, in addition to the PTSD, in addition to the bipolar disorder, and in addition to chronic methamphetamine use. And on that particular evening, she went ahead and committed this crime. So all of these things would have to be teased out in her case by a good court therapist, psychologist, and so forth. And I'm going to suspect that besides the methamphetamine use, misuse, and abuse, there's also going to be some historical presence of a personality disorder, and that's simply because of the detachment that I saw on her part. I hope this clarify some things for you. I hope this gives some information for you. I hope this gives you some scaffolding to look at these kinds of things and understand what could be causing a person's behavior. Again, I'm not diagnosing her. There's not even that much information on her. But from what I've seen, these are some of the thoughts I have. But more importantly, this is how you should approach every one of these things. It's not like Joe Blow did some methamphetamines this night. He went, decapitated someone, played with the body, threw the head in the garbage can. Things are a lot more complex than that. I hope you enjoyed that. Please don't forget to like and subscribe, and see you next time. Peace.